Hi and Assalamualaikum. We are from Group 5. We present about diabetes mellitus. So these are our group members. We have me, myself, Nur Hafiza Rafiq, Siti Nur Asmawani, Nur Akila Husna, Nuri Naziha, Rabita Adawiyah, and also Aisha Faliha. So, for this video, we will present about definition of diabetes, symptoms, risk factors, prevent, recommend and describe, and also our conclusions about this topic. Diabetes is a long-term metabolic illness marked by high blood glucose or blood sugar levels, serious damage to the heart, blood vessels, eyes, kidneys, and nerve can result from diabetes over time. The most prevalent kind is type 2 diabetes, usually affects adults and brought on by insufficient or resistant insulin production in the body. Type 2 diabetes has been far more common over the last 3 decades in all nations regardless of wealth. Diabetes type 1 is a chronic illness in which the pancreas generates little or no insulin on its own. It was formerly referred to as juvenile diabetes or insulin-dependent diabetes. Having access to reasonably priced therapy, such as insulin, is essential for the survival of those with diabetes.
Next is statistic diabetic patient according to states that we found in newspaper The Star online. From the bar chart, we can see that Negeri Sembilan had the highest diabetic prevalence at 30.2%, that followed by Perlis 32.6%, and then Pahang 25.7%, Kedah 24.9%, Putrajaya 22.9%, Terengganu is 20.5%, Johor is 19.7%, Kelantan is 19.5%, and then Penang 18.2%, Selangor and Kuala Lumpur is 18, share the same numbers. Perak is 17.6%, Melaka is 16.9%, lastly Sarawak is 13.1%, and Sabah is 12.6%.
Okay, if someone go to the doctor and doctor said, sorry sir, miss or madam, you are diagnosed with diabetes. Okay, these symptoms below might be occur first before they go to the doctor and know what exactly happened to them. Okay, the first one is excessive thirst or polydipsia. Okay, this condition happen when people always feel thirsty even they drink a lot of water. Okay. Okay, the second one is excessive hunger or polyphagia. Okay. This condition happen when people always feel hungry even though they eat a lot of food, and it is very common for diabetic patient. Okay. The third one is unexplained weight loss. People that suffer with diabetes problems might be face this condition, which is their weight is easily lost without even trying, without they have to go to a gym or do exercises like jogging or walking. Okay. Next, someone that have diabetes might seem always tired and fatigued because of their conditions of hyperglycemia, high blood glucose. This happens when blood glucose levels are too high and the body is not processing glucose as energy. Therefore, tiredness and fatigue might be occur. Another potential symptoms of diabetes is blood vision when uh, their eyes lens keep swelling. Okay, this happens when blood sugar levels change quickly from low to normal. Okay, the shape of their lens their eyelids can affect it and make it their visions blurred. Also, over time, 1 in 15 people with diabetes will develop DME. Okay, D stands for diabetic, M stands for macular, and E stands for edema, which is diabetic macular edema. Okay, this happens when blood vessels in the retina leak fluid into the macula, a part of the retina needed for sharp central vision. This causes the blurry vision. Okay, the next symptom is specifically for women with diabetes. Okay, women that have diabetes may also develop a problem with their vagina, which is they might have vaginal yeast infection. Okay, this happens because of blood sugar levels are really high than normal that can change the pH of the normal vagina, making it easier the yeast to develop, okay, to grow. So, someone that have vaginal yeast infections might seems like have uh, itching, burning, redness, or white and clumpy discharge at their private area, which is vagina. Okay, someone that have diabetes also have this symptom which is polyuria, which is the conditions of the body urinates more than usual and abnormally large amounts of urines every time you urinate. Okay, the symptom may be occur in infants with frequent full diapers and bedwetting in children at the night. Also, someone that have diabetes might feel easily irritable and mood always swing and change. Okay, someone that have diabetes also suffer with this condition which is slow healing cuts and sore. This happen because of inflammation in the cell increase and prevents oxygen and nutrients from energizing cell. Last but not least, the fruity odor from breath also one of the symptoms of diabetes.
Okay, I am Adawia and I want to talk about the risk factors of diabetes. Okay. Okay, first, what causes high blood sugar levels? Several factors can play a role in hyperglycemia in people with diabetes. They include food and physical activity, illness, and medications not related to diabetes. Skipping doses or not taking enough insulin or other medications to lower blood sugar also can lead to hyperglycemia. Hyperglycemia is a common occurrence in critically in patients where even in those without any history of diabetes mellitus, during stress, injury or trauma, glucose metabolism will alter because of change in endocrine secretions and peripheral insulin resistance resulting in hyperglycemia. Okay. Okay. So next, what should be your ideal blood sugar level? The expect value for normal fasting blood glucose concentration are between 17 milligram per deciliter, 3.9 mmol, and 100 milligram per deciliter, 5.6 mmol. In general, less than 100 milligram per deciliter, 5.6 mmol is normal. 100 to 125 milligram
per deciliter, 5.6 to 6.9 mmol. L is diagnosed as pre-diabetes. 126 milligram per deciliter, 7.0 mmol. L or higher on two separate tests is diagnosed as diabetes. Okay, when should you do your blood test? It's a good idea to schedule your blood test as early in the day as possible. There are some things you can do and avoid to make sure your blood test result are as reliable as so doctor can interpret the result and therefore give you the best advice. Okay, what about sport and exercise? The exercise is considered an important therapeutic regimen for diabetes mellitus. Exercise in patients with diabetes mellitus promotes cardiovascular benefits by reducing cardiovascular risk and mortality, assists with weight management, and it improves glycemic control. Being physically active is good for diabetes. Whether you feel able to go for a run or a swim, or can manage some arm stretch or on the spot walking while the kettle boils. It all makes a difference.
So next, I will represent about how to prevent the diabetes. Lifestyle change can help prevent the onset of type 2 diabetes, the most common form of the disease. Prevention is especially important if you are currently at an increased risk of type 2 diabetes because of excess weight or obesity, high cholesterol, or a family history of diabetes. Making a few changes in your lifestyle now may help you avoid the serious health complication of diabetes in the future. It's not too late to take care of yourself. So this is the way on how to prevent the diabetes. So the first one is lose extra weight. Losing weight reduce the risk of diabetes. People in one large study reduced their risk of developing diabetes by almost 60% after losing approximately 7% of their body weight, which change in exercise and diet. So second one is eat healthy food. So we need to avoid eat dairy food every day and can take vitamin D3 and omega 3 fatty acid. So third one is choose higher fiber carbs. Eating white bread, white rice, sugary breakfast cereal or other simple stretchy food known as refined carbs are linked with an increased risk of type 2 diabetes. So the next one is exercise regularly. By doing physical activity may help prevent diabetes. People with prediabetes often have reduced insulin sensitivity, also known as insulin resistance. In this state, your pancreas has to make more insulin to get sugar out of your blood and into cells. Exercise increases the insulin sensitivity of your cells, meaning that you need less insulin to manage your blood sugar levels. The last one is you need to more drink a lot of water without sugar added.
Next, we have recommend intervention could be taken toward kids. Firstly, we have genetic screening and monitoring. By this, we can identify high-risk individual. We can conduct genetic testing to identify children whether they have at higher risk of developing type 1 diabetes, especially family that has history of type 1 diabetes. And then we can have regular monitoring. It is important because we can detect early signs of the autoimmune process that can lead type 1 diabetes. Secondly, we have environmental dietary intervention. We have breastfeeding. By promote exclusive breastfeeding for at least the first 6 months of life, it is important because we know that breast milk contain protective factor that can reduce the risk of autoimmune disease of type 1 diabetes to our baby. And then we have delay introduction of solid food. Solid food particularly have gluten and cold milk, so beyond the first segment, we need to avoid to exposure to certain protein can trigger autoimmune process especially for children. Thirdly, we have healthy lifestyle. We can have a balanced diet by encourage a diet enriched in whole food, including fruits, vegetables, whole grains, and protein to have a good nutrition support in our immune health, and we can get a general well-being. And then we can also do a regular physical activity. By doing that, we can enhance our overall health and potentially improve our immune function. And then physical activity also can give out numerous benefit for maintaining metabolic health. For example, physical activity is running, walking, and more. Lastly, we have education and support. Parental education is very important because by doing that, we can know the early sign and symptom of type 1 diabetes, and then we can know that in the importance of maintaining regular health checkup and potential to prevent type 1 diabetes. We also have support networks, especially family with a history of type 1 diabetes. This network so important to them, and because to provide resources, information, emotional support, and also they can helping family to manage the risk and cope with potential diagnosis. Next, we can describe why patient needs insulin for their therapy. It is because to preventing long-term complication. By have a good blood glucose can control and prevent complication, microvascular complication, such as retinopathy is eye disease, and nephropathy is kidney disease, and neuropathy is nerve damage. And then by managing blood sugar level can reduce the risk of get macrovascular complication such as heart attacks and stroke. We know that these two complications is common in people with have poorly controlled diabetes. Secondly is replacement of endogenous insulin. In type 1 diabetes, the immune system mistakenly attack and destroy the beta cell in the pancreas that produce insulin. Because of that, the loss of insulin production. We know that without insulin, the body cannot use glucose from the bloodstream for energy that can leading to high blood sugar level, that known as hypoglycemia. And then thirdly, maintaining metabolic balance. Insulin is very crucial for the metabolism of carbohydrate, fats, and protein. It helps to store excess glucose in the liver and muscle as glycogen that can prevent the body from using fat and muscle protein for energy inappropriately. Lastly is blood glucose regulation. To prevent hypoglycemia, insulin helps to lower blood glucose level by facilitating the uptake of glucose into cell, and then they prevent the complication associated with chronic high blood sugar. For example, damage to blood vessel, nerve, and organs.
So finally, we have reached to the conclusion. In the conclusion, I will summarize a bit about insulin replacement therapy, prevention challenge and research, and future direction. In conclusion, insulin replacement therapy is essential for managing type 1 diabetes, a condition where the body is unable to produce insulin. This therapy helps to regulate blood sugar levels, preventing the complication associated with both hyperglycemia and hypoglycemia. Without insulin replacement, individuals with type 1 diabetes would face severe health risks, including organ damage, ketoacidosis, and potentially life-threatening situations. Then, basically, the therapy includes various methods such as insulin injections, pumps, and continuous glucose monitoring system. Insulin injections are a common method requiring multiple daily doses to maintain stable blood sugar levels. Insulin pumps offer a more consistent delivery of insulin, closely mimicking the natural release of insulin by the pancreas. Glucose monitoring system provide real-time data on blood sugar levels, allowing for more precise for adjustment in insulin dosage and improving overall diabetes management. Prevention of type 1 diabetes is limited due to its autoimmune nature. In type 1 diabetes, the body's immune system mistakenly attack and destroy insulin-producing beta cells in the pancreas. This makes it difficult to prevent the disease before it starts, as the underlying cause is the body's own immune response. So our focus should be on early detections and maintaining a healthy lifestyle. Early detection through regular monitoring of blood glucose level and recognizing symptoms such as excessive thirst, frequent urination, and unexplained weight loss is crucial. Additionally, maintaining a healthy lifestyle by following a balanced diet, engaging in regular physical activity, managing cholesterol and blood pressure, and avoiding smoking can help manage the condition effectively and reduce the risk of complication. Lastly, research and future direction. Exciting studies in immunotherapy could help stop or slow down the disease. These exciting studies focus on utilizing the body's immune system to target regulate the autoimmune response that leads to the destruction of insulin-producing beta cells in the pancreas. By developing innovative immunotherapy, researchers aim to provide more effective and personalized treatments that could ultimately offer new hope for individuals living with type 1 diabetes mellitus. The future direction in this area holds great promise for improving the quality of life for patients and bringing to a potential cure for this chronic condition. Next, scientists are studying ways to protect cells that produce insulin in the body for patients who diagnosed with diabetes mellitus. They aim to find new ways to keep these important cells safe from being attacked by the immune system, which could lead to better ways to manage and treat this condition that affect how the body's control blood sugar levels. Okay, here is the first image I provide. Is a conceptual framework for how immunotherapy might work to modulate the immune system either by boosting T cell immunity, transiently suppressing T cells to prevent autoimmune attacks, or directly targeting beta cells and the underlying disease process. In the second image, the focus is to illustrate the pathophysiology of type 1 diabetes mellitus, where the immune system mistakenly targets and destroys beta cells, leading to insufficient insulin production. And this understanding can help in developing strategies to protect insulin-producing cells, a key area of research in preventing or treating type 1 diabetes mellitus.